episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Grider. If this is the first time that you're watching this show, just to let you know, I am a pharmacist. I do work for Mark's Pharmacy located here in Northeast Ohio. The purpose of this show is to kind of give you guys a general idea of some basic health topics that are current right now and to give you some health information that you can use even if a health care provider is not present to make sure that you're getting the best care.
You made a weird face.
I know.
Do it again.
Yeah, just start over. You ready?
Yep.
Okay. Hello, everybody, and welcome to another episode of Fun Facts at the Pharmacy. My name is Dr. Christopher Grider, and I'm your host. I work as a pharmacist for the Mark's Pharmacies here in Northeast Ohio. The purpose of this show is to kind of give you guys some general information about current health topics that are going on in the state of Ohio and in general. Also to give you guys some health information, so if you ever have to make a decision without having a healthcare provider, you can at least make an educated one that's good to make sure that you can get the help needed before you go and see a healthcare provider if you can't reach one. To start this off, we have the beginning part of our show called Fast Acting. The purpose of this part is to kind of give you guys some information about what's going on currently. One of the hottest topics and something that gets brought up to me constantly at work is actually in regards to the use of medical marijuana. Now, in the state of Ohio, back in last year of 2017, there was a vote that was put in to actually establish these dispensaries in the state of Ohio. Now, on an interesting note, we did vote against it for a no for at least the financial part of it. But what I found out was these dispensaries are actually legalized from last year's vote. So it's kind of interesting to hear that because as of this year, the State Board of Pharmacy has finally stepped up and they're actually starting to open certain dispensaries. Now, the interesting thing is, as of December 12th of this year, the only thing that's been available is there's been one dispensary that has actually gone through the full process of being verified and being okayed by the state board, and it's located in Winterville, Ohio. Now, that doesn't mean you can't register or can't go and talk to your physician about it. So if it is something that you're interested in, there are different uses for medical marijuana. So a good example of that would be anxiety, glaucoma, pain. These are all big current topics that are kind of hitting the top of the research market right now. So to be honest, if you are interested at all, you can look up at the website medicalmarijuana.ohio.gov, and this is an actual website that helps to kind of guide you along this process. Only certain physicians are certified to do this, so you do need to look that up. And looking at the step process to give you guys a general idea, the first thing you have to do is you do have to go and speak to a physician about it. Now, the main thing when you talk to your physician about it is if he deems it necessary and you have a condition that fits within the parameters of what they would use medical marijuana for, then they can actually write out a prescription for you and register you on the website. Once the registration's done, they do contact and email you about it, and when they email you, you have to register yourself on there. Now, granted, it isn't a free process, so don't think that you're getting away scot-free with it. However, it's a $50 cost for an annual, essentially, registration to be on their website, to be allowed to have the card to be able to get medical marijuana. Now, they do say that on the website there are ways to get discounts on that, whether you be a veteran or if you have financial need, but it is something that they have to dictate as necessary. On top of that, once you're done with the registration, then you have to get it from a legalized dispensary. Now, here's the thing, with only having one available, it's kind of hard to get your hands on anything like that. However, they are stating that by the year 2019, a lot of them should be popping up as of right now. Now, keep in mind, medical use is not the same as recreational use. So it isn't legalized to actually be used as a recreational purpose. So if you wanted to do it for pleasure, that's not something that you could do legally. However, if you do get the okay from your physician, it would be something that's a possibility. So if you have any more questions, by all means, you can always contact a pharmacist or talk to your physician, as they're the ones that have to kind of guide you in the right direction there. And like I said, you can use the website to kind of take a general look to see if it's something that you're interested in, or if you have been approved, it's the next step in the process to get registered. So with that being said, we'll kind of move on to the main topic for today. So kind of switching gears, we're going to talk a little bit about cold and flus because most of the time, especially at the tail end of the year and the beginning of the new year, a lot of people tend to get sick. So we kind of want to make sure that we're hitting and that you have an idea of a little bit of what we're talking about to make sure that you're getting the right products. Because I'll be honest, if you walk down any one of those aisles, whether it's at a grocery store, whether it's at, a Target, a Mark's, a CVS, there are products upon products that take up literally an entire aisle. But the funny thing about it is with those, there's only 6 main ingredients that are typically used in different amounts and different combinations throughout that. So instead of spending a fortune, we're gonna kind of talk a little bit about what we'd be looking for and how do we go about treating yourself the best way with the symptoms that you currently have. So to kind of start things off, the main things to look out for is how do you know if you have a cold, a flu, how do you know that you're ultimately sick? Well, one of the things to kind of keep in mind is that there's certain symptoms that people tend to have. Now, it's a little bit different than if you were to get a flu shot because we'll kind of hit that a little bit, but the main thing to remember is that when you have a cold or you have a flu, a lot of people tend to experience similar symptoms. Those symptoms may include a fever, they may include aches, chills, you might have some pain that's going on right now, you may be tired consistently. Those are all very common, and then you may have also cough or runniness that's going on, so a runny nose, running eyes, that sort of thing. So the main thing to remember is that when you have these symptoms appear, a lot of your cough and cold medications that are out there right now are something that they ultimately help to treat the symptoms. There's 2 different types of ways of looking at it. So with a cold, there's 2 things. It could be a bacterial infection or it could be a viral infection. With the flu, it's always a virus. It's never caused by anything else. The hardest thing about viral infections is you can't readily treat them. Now, some people have come up and have asked about products like Tamiflu. It is something that is available as a prescription. However, there isn't a lot of proof to really justify its use for the cost. If it is a covered medication, then by all means, it can help with a lot of those viral infections that you may be dealing with. But in regards to bacterial infections, those are the ones that most people would normally ask for an antibiotic for. But before we jump to that, I normally tell people, especially that come to my pharmacy, how long has it been going on? Because the best thing that you could ever do is let your own immune system take over. So with that being said, some of the things that you can possibly use that may help out for a patient that don't require, the use of medications is plenty of rest. That's number 1. Plenty of fluid is another thing. So we're talking normally water. But the main thing is if you are experiencing any unusual symptoms, typically something like diarrhea or possibly vomiting, which is not pleasant to begin with anyways, you can use something like Gatorade or Powerade. The nice thing about those products versus just regular water is that they help to restore the electrolytes. I'll be honest with you, if you're constantly going to the bathroom, if you're constantly having problems where you feel like you're vomiting all the time, you're losing not only a lot of water, but you're losing a lot of electrolytes. And if you're not restoring that, you're ultimately making your symptoms worse. By making your symptoms worse, it's going to make it harder on your system that it may in turn actually make you feel sicker than you were before. So this is just a very simple and easy way to kind of help solve that part of it. The other thing that we're going to look at is the use of vitamin C and euthanasia. So euthanasia or echinacea is a product that's typically recommended as an herbal that's been found to have some ability to help boost your immune system. Now, the proof behind the use of vitamin C and the use of the echinacea are 2 different things where, to be honest, the research hasn't really justified the use of it. There's very little evidence that's really supported the use saying that it 100% will help to prevent or fight off an infection, whether it be a cold or a flu. With that being said, it is your discretion if you wish to use it. I always tell people vitamin C is nice because as long as you haven't been told by a physician or someone else that you have any kidney problems, your body cannot overdose on vitamin C. That's the best thing ever. You can just ultimately take it in and then your body will naturally get rid of any excess that it's not using. With the echinacea, we always have to be careful. The one thing I always tell people is if you are on any medications that are used for blood thinning purposes, so we're talking high dose aspirin, which is normally the 325 on a consistent basis. We're talking about Xarelto, Eliquis, warfarin. These are all main medications that we always have to be very careful about because the use of herbal products have a higher chance of causing an increase in bleeding effects. So sometimes, especially with those types of medications, if you're trying to prevent clots, it's a good thing that when you don't, but at the same time, we also have to be very careful because it may make you more prone to bleeding. And if something was to happen, say you cut yourself, it would take much longer to get the help needed. So always be careful whenever you're using those products. If you ever have questions about those particular things, make sure you talk to a pharmacist. We are the go-tos for those drug interactions. And if you have a follow-up appointment with a physician or a doctor, by all means, you can ask your doctor or nurses. They can also try to help you out as well with that part. But with that being said, I don't necessarily recommend going that route. The main thing right now is plenty of rest, plenty of fluids. That's the best thing that anyone can do because, like I said, your immune system is your number one go-to. There's a reason that we've developed it over the years, and it's ultimately the best product that can ultimately help to stop an infection. With that, it also takes time. Now, the biggest thing is a lot of these infections, you don't know that you're infected until you're highly contagious sometimes. So the main thing is you may not notice symptoms for at least a few days, even though your body is infected at the moment. It's not saying that you're necessarily contagious, but I always say it's always better to be cautious in those situations. So using things like Purell and cleaners to kind of wipe counters down, use it as needed, especially if somebody's actively sick. But we also have to be careful too, because one of the biggest issues we're running into, especially with our kids nowadays, is that with the use of Purell and other products to help prevent infections, they're not developing their immune system the way that they're supposed to. So I always say use it, but use it seldom. You don't have to go crazy about it and wipe every single surface down every single second of every single day. Ultimately, getting sick is not the end of the world. It's meant to help boost your own immune system so that your body knows what to do the next time that this comes around. The other thing that you can also do to help prevent, especially the flu, is an annual flu shot. Now, I know immunizations is always a hot topic, and it's something that we do, at least myself, I strongly support. It has been shown over the years that it's very beneficial, and a lot of the evidence saying that the use of immunizations has caused autism, a lot of it's been disproven. So we always have to be careful about that for what we suggest to people. But I'll be honest with you, it's the best way to give your immune shot any chance of fighting it. And the reason you have to do it every year is that your body builds the immunity over time. But sadly, when you're not dealing with any kind of active infections, it does tend to fall off a bit. Now, moving on to the next part of it, well, let's talk about a little bit about medications that we can use. So with medications, the nice thing is I had actually brought some products from my house. Now, the things to remember are, like I said, down this aisle, you're going to find a bunch of different products. You're going to have no clue. They all advertise different things, whether it's sinus congestion, cough and cold. I mean, there's a list upon list of things that they do. But the main thing to remember is that we're ultimately trying to treat the symptoms, because when you get sick, you may not have the same symptoms as the next person to you or anybody that lives in your household. So we want to make sure we focus on you. So the one thing to remember is that a lot of these medications are typically meant to cover multiple symptoms. The one thing is, if you have any history or use of excessive amounts of Tylenol, be very careful on these products. The reason I say that is a lot of them contain something called acetaminophen, which is just the generic name of Tylenol. That is mostly meant to help with the pains, aches, and temperature. So if you are starting to break a little bit of a warm temperature, it'll help to bring that down, and especially in young children. With these products, the other thing to remember too is if you have anyone under the age of 6, be very cautious. They recommend that just because with a lot of young kids, their bodies haven't fully developed yet, so we can't necessarily just give them the exact same things that we would possibly use. So I always say if you have any questions, always read the back of the boxes, because as most of these products will contain, they normally have listed somewhere on here the active ingredients, and they'll have a breakdown of the ages for you. So you have a general idea of how old the cutoff is for most of them. Most of the time it's 6 and older, I'll be honest with you. Some products may go as low as 4. If it's less than 2, I normally say make sure you're going and checking it out with a pediatrician, because they want to make sure that nothing else more severe is going on, and that we're not giving them medications that their bodies cannot tolerate at the moment. So just to give you an example of a few things that I have in my own household, a couple of products are always branded a little bit different. So most of these are actually generic products. And the reason I say that is because they're meant to work the exact same way. So for cost purposes, I normally tell people, unless you are very set in your ways about trying to go with a certain brand, the generics work just as well. They have the exact same amount of active ingredients as their counterparts. So a good example is these 2 products that are listed right here are actually Dayquil in the front here, but they're 2 different manufacturers of it, so that's why they advertise it. But they always have a comparison that's there to tell you what it's the closest thing to. This one over here is actually a nighttime medicine, so it's the exact same thing as NyQuil. Now, I'll be honest, the difference between a Dayquil and a NyQuil, if you ever look at the products themselves, there's one extra ingredient that's an antihistamine. Now, the purpose of that medication is to help break down and stop the drainage and drippage that's going on. So if you have a runny nose, if it feels like something's hitting the back of your throat, that works well for that part of it, but it does have the possibility of making people feel tired. So we always have to be careful about that, and that's why they recommend those for nighttime use or when you're going to bed. The products that I have here in the back actually are two different products. These are actually antihistamines by themselves. So one is a generic version of Zyrtec, which is this green box here, and this one is a generic version of Claritin. Both of them, like I said, the antihistamines are nice because they'll help to dry up any kind of runniness or drainage that's occurring, or if it's tickling the back of your throat and causing a cough. It's a very easy way to fight that. The nice thing about those is they're once-a-day medications for at least the ones in the back. The other ones in the front here, the Dayquil and NyQuil, typically you can do those every 4 to 6 hours. And like I said, there's different combinations of ingredients. So with these ones, you'll always have a Tylenol substance in there, so the acetaminophen. You'll always have the dextromethorphan, which is the cough suppressant. And then you'll also have the nasal decongestant, which is the phenylephrine. Now, the main thing to remember is the decongestants we always have to be careful with, because if you have high blood pressure, these are not recommended for you just because they can raise your blood pressure even more, or if you have heart complications. So what I would recommend in that case is there is a product called Coricidin. It is HBP, which is high blood pressure. They're indicated for patients with high blood pressure because they have a lot of the ingredients that you need, but cut down to it a certain extent, and they take a lot away any of the medications that would normally cause any harm to your heart or your blood pressure. The final thing I have over here, just to show you guys, is a cough suppressant, and this is actually from CVS. But there is a certain products that will come individual. So Delsum is a great product. This is just the generic form of it, so that's why they call it the cough DM, so to speak. But what it is it's ultimately meant to help with a cough. It's used every 12 hours. It's an extended release form. So it's kind of nice that if you have a severe enough cough, this is an easy way to kind of stop that. Besides that, for the most part, all your other products are going to contain any combination of typically a pain reliever, a cough suppressant, an expectorant, which is typically like your Mucinex. Now, the expectorants, I'll let you know right now, it's not your typical go-to. A lot of people tend to jump to those, but the reality is they're normally best for when you have chest congestion is what they term it. If it feels like something's stuck in your chest and you're trying to cough it out, make sure you can use something like Mucinex because it's going to help to get it out. Now, if you do decide to use a product like Mucinex DM, it works great, especially if you're working throughout the day and you don't want to cough more, because the expectorants make you cough, but the DM, which is the dextromethorphan part, stop the cough, which is great because it makes the cough more effective, but has you cough less frequently. So that's the nice thing about the Mucinex DM. But the main thing to remember about it is you have to drink plenty of water with it. The way it works is it ultimately, when you drink the water, it helps to bulk up anything that may be stuck in your chest, and then when you cough, it effectively gets it out of your system. So if you're not drinking enough water throughout the day, it's not going to do you any good, and you're ultimately just throwing your money away. The only times that I'm ever concerned about with these products that you may need to go and find help or go to your doctor's office or emergency room is in certain situations. So if you've had a persistent, cold or flu symptoms that have been going on for longer than typically about a week to 2 weeks, it's not a bad idea to schedule an appointment to get it checked out to make sure that it may not be something else such as bronchitis. This way we can get the right treatments for you that may require a prescription at that particular point. Besides that, if you have a temperature that breaks normally around a 102 or 103, that's definitely an emergency room visit because something more severe is going on and we want to make sure that your body's not going into any kind of shock and that it's not damaging itself, because at very high body temperatures, it can actually cause more damage than good. So we always want to make sure that we're actually getting you checked out to make sure there's nothing more severe going on. With that said, that pretty much kind of sums up at least the cough and cold section. If you ever have any questions or doubts about anything, by all means, please talk to your pharmacist, because if you're not sure what to get, we're the best go-to for you. If you're by yourself, like I said, make sure you're reading the back of the packaging to make sure that you're getting the right products for yourself, because even though in the front of it, we're a very hustle and bustle, go and run around type society, but the main thing to remember is we always want to make sure that you're checking out that you're getting the right products, because like I said, there's so many different ways to advertise the same product to make an extra $1 that you don't realize what it is that you're getting until you've already purchased it and used it and realize it's the wrong thing. So make sure you're reading the back of the packaging just to at least get an idea of what the products are so that you know that you're getting the right things for you. Besides that, keep everything as clean as possible and make sure that you stay away from anyone that's sick. But besides that, we're good to go. So if you guys ever need anything, by all means, make sure that you're talking to your healthcare providers, whether it's your physician, nurses, or pharmacists. And with that, that's the end of another episode. So we'll see you next time.